Okay, let's kick things off. Good morning and welcome to today's Coffee Chats, hosted by Economic Alliance Snohomish County in partnership with the Snohomish STEM Network. My name is Alyssa Jackson, Director of the Snohomish STEM Network, and I'm thrilled you're joining us for this critical conversation on childcare and early learning in our community. Access to affordable, high-quality childcare isn't just a family issue, it's a workforce and economic development issue. When families can't find or afford care, parents are forced to leave the workforce, businesses lose valuable employees, and our economy loses momentum. Today, we'll share insights from two recent surveys, one capturing the voices of local employers, and the other reflecting the experiences of families and providers across Snohomish County. Together, they'll paint a clear picture of the challenges we face and the opportunities to build a stronger, more sustainable early learning system. We're fortunate to have a fantastic panel with us this morning. They'll highlight survey findings, share progress from county-led projects, and discuss how collaborative efforts are driving solutions. After their presentations, we'll open up a Q&A session where you can add your questions in the Zoom chat. Let's get started by introducing today's panelists. I'm pleased to welcome four leaders who are advancing this important work. Debbie Carlson, former director of the Snohomish County Early Learning Coalition, who will share insights from a 2025 countywide survey capturing their perspectives of families and providers on access and affordability. Dr. Jennifer Pellicero, executive director of Close Reach Academy and co-chair of the Snohomish County Early Learning Leadership Council, who will provide an overview of the council's work to strengthen coordination across the early learning system. Karen Matson, division manager at Snohomish County Human Services, who will highlight the impact of ARPA-funded projects that have expanded licensed child care facilities and workforce development efforts. Also, Representative Carolyn Eslick, Washington State Representative for the 39th Legislative District and ranking minority member of the House Human Services Youth and Early Learning Committee. Representative Eslick brings a valuable legislative perspective to today's conversation and will speak to how the state is addressing childcare access, affordability, and support for providers, especially in fast-growing areas like Snohomish County. All right, Representative Eslick, might you share a few words to help set the tone for today's conversation?
Thank you. The tone, I think this year has been um, really hopeful. After years and years of talking about the childcare problem that we have in Washington State, finally, our conversation about 8 months ago with DCYF was, yes, we've been hearing the same things for the last 2 years. Well, we know it's been going on a lot longer than 2 years, but the fact that we actually got the bill, and it was Representative Tom Dent from Moses Lake, who's been a champion for childcare providers for all his time in the legislature. I think it's about 10 years. I've been there, not, excuse me, 8. And since I've been there, I kept hearing about the problems and seeing and knowing my own constituents having the problems that they had with starting up a child care business, finding child care that you can afford, all the basics, and so many moms and dads staying home to do their own child care. But the fact that we could get House Bill 1648 through this year was nothing less than a miracle, in my opinion. It always takes years to get something through. I say 5 years usually, but this one took longer than that. It's a big jump. I mean, we are going to be this childcare licensing started in the 80s, and frankly, Washington State just kept adding more regulations and more regulations till we got to the point of now we have a 457-page manual to help childcare providers run their business and a 100-page checklist before they can start their business. They have to go through. And I guess one of the biggest complaints, and it's still happening today because we had a caregiver experienced provider over in Eastern Washington just trying to get her place open. And one of the problems is they keep sending a different inspector and different a mentor to help her. And so they would come with different regulations that interpreted differently by each one of them. So we've got to make some corrections. And I've been in touch with DCYF just even this morning to find out when are they going to start appointing the stakeholders. And she is going to get back to me today, but they are they've done a lot of work already since we got out of legislature, and they are now this month looking at requesting stakeholders, and they're looking at no less than 10 for the stakeholders committee. So I'm here, I'm staying on top of this. It's such a crucial point, especially to Snohomish County, that I would be glad to also give you my phone number before we get off today so that people can text me and ask me what's going on. Thank you for this opportunity.
Yes, no, thank you. Thanks for sharing that update. And thank you for all of our guests for joining us today. I'm going to kick things off with a bit of a recap of our 2024 business survey findings. I have a few slides here. There we go. So the target audience of this survey was business leaders, HR professionals, policymakers, and anyone interested in understanding childcare challenges. So Representative Eslick talked about some of the work happening in the legislative. We wanted to hear locally from businesses in Snohomish County, as well as the region. You can see we worked with quite a few partners to take a look at the problem and hear from employers. Next slide, please. So first, we wanted to set the tone on what are the economic impacts of Washington State's childcare crisis. And it is a crisis. And in Snohomish County, it's actually referred to as a childcare desert, which means we do not have enough slots for children who need childcare. So this data comes from Ready Nation. This is from July 2024, and they were able to calculate that this crisis is costing Washington State $5 billion a year. And you can see the breakdown there on the cost to parents, businesses, and taxpayer. So we know that for businesses, this means about $5,400 are lost per working parent. And this is lost through revenue losses, extra hiring costs, so the turnover, retention, and this shows that we have insufficient care for children aged birth through 5. So by the way, this $5 billion is just that, ages birth through 5. If you increase that age, birth to 12, the impact rises to $6 billion. So this current system is not meeting the needs of Washington families or Washington employers. And there's a ton of interrelated challenges that combine to build this crisis for children, families, and businesses, including, we mentioned this earlier, and Representative Eslick mentioned some of this, access, affordability, quality, living wages, all of these lead to the childcare crisis we have. So we know this is an economic impact. Let's take a look at what our local employers said here in Snohomish County. Next slide, please. Okay, so why did we survey them? Well, we wanted to understand from the local perspective, how is lack of childcare affecting their workforce and what benefits or solutions might they be considering? We heard from 50 diverse employers across various sectors. And the first question, next slide, was, do you have trouble retaining or hiring people due to childcare shortages? As you can see, it's an overwhelming yes. At this point, we only had 48 respondents, but by the time the survey closed, we had 50. So of them, 63% said yes. They could clearly define that retention and recruitment were impacted from the lack of childcare. Next slide. We asked, what are you offering? And overwhelmingly, we found that most employers offer no childcare related benefits. In fact, the key stat here shows that 60% of employers offered no childcare related benefits. And those that do offer benefits tend to focus on flexible schedules or flex spending accounts. And there were a few barriers that they listed. Let's take a look at the next slide. Top barrier, I don't know that anyone will be surprised, but money was the top barrier, followed by lack of infrastructure, lack of knowledge of options, And even though there was both interest from the employers, there was obstacles on where to begin. Next slide. So then what if those barriers were removed? What might employers offer if those barriers were removed? The interest is there. Employers wanted to offer childcare vouchers or stipends, increase their flex spending accounts. Maybe they don't offer them yet, or offer backup care. And we found that only 4 employers said they would offer none, even if barriers were lifted. And they cited this was because their current workforce didn't need it, did not need childcare benefits. Of course, we know that for employers, we want to stay competitive and workforce might turn over. And so something about looking ahead at the future. So the last slide here I have shows us when we surveyed the employers, they wanted to do something about it, if only those barriers were removed. So only 4 there are currently a variety of technical assistance resources available for businesses, both for providers who are running their own childcare facilities, and employers who want to offer benefits to their employees. And 2 of them that we asked about was from Washington State Department of Commerce, the Family Friendly Workplace, and the second one was CREC, which stands for Center for Retention and Expansion of Childcare. And they work with Opportunity Council, which I think I saw Elaine on the call here, on the meeting here. So both of those organizations offer technical assistance, and yet only 4 of the 50 businesses surveyed had even heard of those opportunities. So, and they're no cost, I should clarify. So this shows us that employers care about childcare access, but they need support. So perhaps some takeaways are targeted outreach and industry specific strategies can help bridge the gap between interest and action. And now that leads me to Debbie's survey. Debbie, can you walk us through the provider and family survey reports? So we heard from the businesses. What did you hear?
Yes, thank you. And thank you for the Economic Alliance for having me on this call here. Yeah, I would love to talk a little bit about the results of our survey. So if you could go to the next slide. I wanted to start off on going over a little bit who participated. We actually got almost 500 participants in the survey, and that's both families and providers. We conducted 7 focus groups. A little bit about the participants in the survey, and again, we specifically focused on family and providers and the impact of the childcare crisis, specifically in Snohomish County. What we found is that 43% of families and providers were making less and under 75,000 a year, and actually 16% made under 30,000 a year. We, for our families, 14% of our families had children with complex needs or were living with disabilities. And we found that disproportionately families in this bracket were either low income and or BIPOC, people of color, or both. We found that 9% of families lived in rural areas and 17% of families were single parents. And then you can kind of see a little bit of the rest. Thank you. Overall, we know that within Snohomish County, 80% of residents live in extreme childcare deserts. So we asked a couple of questions of families, like what do families look for when choosing childcare options? And also, what are the biggest barriers? And so you can see there's definitely some overlap in both areas. For barriers, for families, 44% said wait lists was a barrier. 40% said that they did not qualify for financial aid, but still could not afford childcare. So cost was a barrier. 31% identified mismatched hours. In other words, when families were working, childcare facilities, centers, providers were not open. And then 29% said that proximity was a barrier. There wasn't a childcare provider close enough to their home. Next, please. So we also asked, like, what are families doing to utilize childcare? What are they doing? So we found that 36% of our families are utilizing friends, family, and neighbor care, which is more of an informal care system. We found 28% are utilizing child care centers. 31% are actually staying home. And we'll talk about the impact, the economic impact of families in the future. 24% stated that they're trying to make it work by working flexible hours or working remotely. And then 14% are utilizing licensed family providers. So we have for providers, licensed family providers, we have like a little over 40% of families that are using licensed providers. What we also found and what families told us is that they really rely heavily on word of mouth to find childcare options. They don't actually use websites or directories. And that was a really big find for us as we move forward with recommendations. Next, please. Subsidies. This was a question also for the panelists, but I wanted to go over what we found out from families. We found out that 20% of families utilize subsidies or working connections, but we also found out that 41% were aware of the subsidies but did not qualify because of income thresholds. So that's the middle class gap. They still can't afford it, but they don't qualify. 31% actually said they weren't even aware of the subsidies. And this actually predominantly or predominantly BIPOC and immigrant families were within this group, and which is really interesting because those are often communities that are harder to outreach to. So in thinking through recommendations and strategies, we want to pay attention to that. We also found out that 8% know about subsidies, might qualify, but did not qualify. And when we went deeper, we found out that some families felt like the system was overwhelming the application system and they didn't try, or some families also felt like their incomes would change over time. And so they might qualify now, but then not. And so they didn't even bother to qualify or to apply. Next. What I wanted to really go over was the economic impact. Alyssa just talked about the economic impact for businesses. Here's the economic impact we found out for families. 20% of family participants said that they quit their jobs in order to deal with when they started having children. 40% reduced their hours due to childcare issues. 32% said that they turned down promotions or even job opportunities. We also found out that 35% identified that because of childcare costs, they had a harder time actually affording basic expenses like rent, food, and healthcare. So it really had an economic impact for families. And then 17% even identified that they found it difficult to even have stable employment due to unpredictable childcare arrangements. So this has a huge impact on families. And so if you could go to the next slide. Now we're going to talk a little bit about providers. So a little bit about who actually took our survey. 43% were child care center owners. 41% were licensed family providers. And then 22% identified as family friend and neighbor care. So you can see even though our families rely more a bit on either staying home or family friend and neighbor care, a little bit more informal care. There's a bit of a disconnect as far as families and providers here. And then you could kind of look at more of the demographics. And I'm not going to go into that. We're going to go, if you could do the next slide. What I wanted to really talk about were the barriers that were identified from providers. 62% identified that limited funding access was a huge barrier for them. That's from loans, from grants, but also from reimbursement rates for subsidies, and even the difference between market rate, which is what currently child care providers receive from families, versus cost of care, the actual cost of care. So there are some discrepancies. Even though childcare is expensive, it actually takes to really fully have competitive wages. It takes money to run a childcare, as we can guess, and it's childcare businesses are struggling around this. A Also, like I said, 52% are struggling around wages and therefore staff turnover. 42% identified hiring staff as a barrier and therefore retaining staff. 40% said high mortgage costs, so facilities. What we also found out that 35% of our providers that we surveyed said that they had vacant slots, childcare slots, and that 8% actually identified that they were even struggling to fill those slots. Another barrier. So, who do our providers serve? What did our providers tell us? We found out that 39, almost 49 or 40% do provide, serve infants. 60% serve children over 5 or older, which is like child school age care. Our providers actually are smaller providers. 32% serve 1 in 5 children, 23% served 6 to 12 children, and then we had 8% that served 100 or more children for their childcare business. As far as who were the student body, what children were served from our providers, 81% said that they served low-income families. 66% said that they served children with disabilities or complex needs, and 58% said that they served immigrant families. So our providers are serving pretty diverse populations. A little bit more about barriers to filling slots. So this is what providers felt like and their perspective on why it was challenging to fill their slots. Definitely cost was an obvious, and that was the largest one. 54% said cost. But 44%, and that was the second highest, said a lack of awareness of parents. So a lack of awareness of their available slots. And then 38% of families said that a barrier was because their families did not qualify for subsidies. And that disconnect between do they qualify, do they know about them, and that middle class gap. And then as far as the solution, childcare providers, 75% identified that if they had stronger marketing outreach, it would help with filling those spots. Now, we also asked about what are providers at risk of closing? We have a childcare shortage, but what's happening with childcare? Will there be even less childcare providers available if we don't take action now? What we found is that disproportionately 31% of providers that are at risk for closing are BIPOC. We also found that providers who serve infants are actually more at risk of closure, and that is also because it is more costly to provide services for infants. It's a lower teacher to student rate, and so therefore there needs to be more teachers around this, and that cost. And then 21% of providers actually stated that they were at some risk. That's almost 25% of providers did identify that they were at risk for closure. We also asked providers what they think will help them. A 67% said direct funding for wages and benefits, really recognizing that a stable workforce is imperative to the success of childcare providers. 63% identified higher reimbursement rates for subsidies. And we can talk a little bit, there's a question about that. We can talk about that more later. 59% said access to low-cost loans and grants, again, funding. 35% said more resources to support business operations, which is right, it's different than wages, but there's not a lot of funding out there to do that, so there's a gap. And then 29% identified possible tax credits or incentives that could help providers really support their businesses and strengthen their businesses. So thank you.
Thank you, Debbie.
That was a very quick recap because this was a 56-page report. And so I appreciate people's,
Yes,
I
it's
know that
great.
went fast.
And
Appreciate that.
I think we're going to be emailing out links afterwards. So we'll make sure that folks who registered will get the resources. It's a very thorough and in-depth survey with with 500 participants. So we're very excited here. Let me toss it to Jennifer here. So Jennifer, take it away. Can you talk to us a little bit about the Early Learning Leadership Council?
Yes, thank you, Alyssa, and thank you so much to the Economic Alliance for having me here today. I come representing the Snohomish County Early Learning Council as the co-chair representative of that group. We were tasked with creating the survey and the report that we just got to hear about from Debbie. Thank you so much, Debbie, for that very robust summary. But our council was tasked with creating the survey and creating the data points that we collected this past spring. And it was a very ambitious goal, I might add. We only had about 5 short months to not only create the tool from scratch, but then also disseminate it out to the different community groups that were our target audience. And as you can see from Debbie's presentation, we yielded a wonderful, comprehensive, robust data set of both qualitative and quantitative research that now paints a wonderful picture, well-rounded picture of the crisis that we are experiencing in Snohomish County regarding childcare and early learning. And although some of the numbers and the data that is presented is not so much a surprise to us, where we take it from here is what is really important. So it's great to have the data. It's great to have this tool and this report to work from now. But as a council, what we are striving to do is take a look at the recommendations that now came from these numbers, from this feedback. And we, as a group, as an entire council, have put it, kind of narrowed it down into 3 categories of recommendations to help support providers, families, and then the funding that we feel would be needed to actually create the inertia, the momentum, behind these recommendations to get them moving forward. And so I'd love to spend a few minutes highlighting briefly, those different recommendations, and then go further into what our plan is as a council to continue this work. So looking at providers, as Debbie mentioned, we yielded great, robust data set from providers in the area and from a wide range of providers. So from in-home providers all the way to licensed facilities and a different variety of sizes, of facilities that support all different size demographics of kiddos. And so, but what we found was that these particular providers ended up having similar struggles, no matter how big or small, their centers were. And so when we took a look at that as a council, we really found some different commonalities and different threads of what the providers were saying. And so some of our recommendations for providers and to help provide support to providers are planning navigators. So partnering with Snohomish County, and these, of course, these recommendations are very summarized for the purpose of this morning's presentation. In the report, they are more robust and comprehensively laid out. But for the sake of time, I'll just kind of quickly pinpoint some of the important parts of them. But it's partnering with Snohomish County to provide dedicated support for childcare providers navigating permitting requirements. So what we have found is that the obstacles for childcare providers start from the very beginning. As Representative Eslick so boldly mentioned that it's the licensing process in general. Not only do we come across huge obstacles once we open our doors, but never mind the actual initial process that it takes just to get from starting to opening the doors. That in and of itself can cause providers to hesitate, can even cause providers to not even fulfill and finish the process to open their doors to function, to serve the communities that they reside. And so we thought that if there was more support from even the very beginning for providers to help them navigate that process, it would be a tremendous value add to providers, as they are likely starting their business with a passion and a heart for early learning, but certainly not the know-how and the knowledge of city planning and permitting and all of these other, engineering and, financial language that they might not be exposed to prior to the beginning of the licensing process. And so also along that same vein is trusted provider navigators. So launch community-based childcare navigators to assist with licensing, business setup, and regulatory guidance, supported by new and existing funding. And again, so those kind of go hand in hand with working on not only the licensing side, but then also the business side of how to actually navigate the nuances of business management, how to hire, how to create marketing platforms, how to get your business known out to the community before you even open your doors. Because as a provider, we have to put everything up front. We have to put all the investment, all of the time, all of the money up front, with absolutely no guarantee that our return on investment is going to come and when it's going to come. And so helping providers get ahead of that and to be able to be prepared to withstand a several month process of being able to financially support that process before they even open up their doors. So knowledge, help, guidance, uh, uh, really mentoring in those areas would only help providers feel very empowered and equipped to launch their childcare business, and then to do it in a way that creates sustainability so that we're not seeing providers who are nervous about closing their doors. We need more childcare providers in Snohomish County, not ones that can't make it only because they've been set up for failure from the very beginning. And then again, from a more of a social emotional impact, so that was a little bit more practical application, but the peer provider mentorship is really in line with community, creating community between providers, maybe licensed providers that are a little bit more seasoned in the industry, communicating with newer providers who are trying to get into the industry, and really creating like a peer mentorship program where we can come alongside of each other, encourage one another, help each other overcome those obstacles, and really build that stronger business from the foundation. And all of that really culminates towards more access and health towards provider mental health, because it is taxing. As a provider myself who has 4 locations now, it is absolutely exhausting to go through the licensing process. It's isolating. It feels lonely. There is very little support from a licensor or from DCYF in the process. And so if as providers, we can support one another and be there for one another by way of that mental health, that social emotional time that can be very taxing, we could create those mental health partnerships with each other to really help each other, withstand some of those barriers, and really create an opportunity for a lot healthier providers. Burnout is a real part of our industry, both from a provider and an educator standpoint. And so if we can get ahead of that from the beginning and create supports for that, we can really see a lot of providers that would be healthier from the outset. And then, of course, as Debbie highlighted, the report yielded amazing data from families. We have parents and caregivers who are struggling to find childcare, to afford childcare, and we recognize the gap that there is, for families. And this decision that oftentimes they have to make in choosing, to put their child in childcare versus take that job promotion or to work at all. And so really, taking a look at those results, the council has recommended two specific recommendations to help support families. One is a family trusted messenger. So launch a program using trusted community members to inform families, especially underserved groups, about childcare openings and resources, including funding options like Working Connections, and pair with an outreach campaign. And so again, we learned here this morning that word of mouth ends up being one of the most comprehensive ways that families find out about childcare in their communities, and also how they feel more comfortable, utilizing those childcare services. And so if we built a program that had family trusted messengers, we are already taking care of both sides of that. So we're not only educating families in the area about the resources that they have at their disposal, but also we are utilizing word of mouth feature to help childcare providers market their company, market their offerings, market what they do and how they serve the communities. And then, of course, education with complex needs. Since COVID, and since we all went through the pandemic in the early learning industry, we have seen a vast difference and a great growth in children with complex needs. We see children presenting earlier and earlier with behavioral obstacles, with social and emotional learning complexities, and all kinds of obstacles that create a nuance for providers and teachers and families to finding childcare that actually meets the needs of these children. And as we all might know, we have a very high expulsion rate in the state of Washington for preschoolers, which is an extraordinarily sad statistic as we take a look at this survey and the results that we yielded. And we can see that it is no wonder with 14% of the families that we surveyed, and we know there are more, since the definition of complex needs or children with disabilities or special needs can vary. And parents and caregivers might not even know that their child has a complex need yet, right? We could have a 1-year-old that is nonverbal, but we don't know yet what that means as they turn 2 and 3 and 4 and 5. And so we want to provide more education and ongoing education for families and parents of children with complex needs to support neurodiversity, inclusivity, to have a platform for support of cultural differences, and to be able to connect those families with providers who also share that like-mindedness and have those values of serving children with complex needs. There are a lot of providers out there that want to and have the heart for it, but they don't necessarily have the knowledge, the education, or the funding to help support those families. And this is not a number that we are going to see go down as we move forward into the future. We are only going to see complex needs as our research and as our understanding of science and how the brain works and cognitive development in early learners just continues to grow. We are going to see this number continue to escalate. It's not that we have more children on the ASD spectrum in 2025 than we did in 1998. It just means that our science and our research is moving forward, and we're able to identify those complexities at an earlier and earlier age, which then leads to more early intervention, which is amazing. But we also need to make sure we have the platforms to support that intervention. And of course, knowing that all of these recommendations are going to require funding. And although as a council, we don't have all of that figured out yet, these are two ideas that came from the council members as we want to launch these programs. And so piloting an early learning endowment fund so that we can start a fund that will partner with organizations like the Community Foundation of Snohomish County and create those platforms of sustainability so that we can actually launch these recommendations well, and not just launch them short term, but actually create funding that will have long-term impact so that we can continue moving that needle forward positively in Snohomish County. And then also some other ideas that came out of the council were to take a look at the PASTA funds or other type of accounts like that, and maybe reallocating some of the funds in Snohomish County to drive these initiatives. As we know, early learning, if we have more supports for early learning, then that then only goes to support K through 12 and so forth and so on. And so we have to start at that foundational level. So as a council, we are taking the rest of 2025 to put this information in front of as many audiences as possible. All of us have a different relationship with early learning, which is amazing. We have a wonderful mosaic of people who are like-minded with their vision and values, but also have a different relationship within the early learning space. And so we are trying to get this information, this report, in front of as many audiences as possible that represent, a multidisciplinary approach to early learning. And then from that audience, we are hoping to gain more support, more insight, more community partners in order to launch a robust work plan in 2026 to actually move some of these recommendations forward. And so that is where we are at with the Snohomish County Early Learning Council and some of the recommendations that stem from the report from this past spring.
Thank you. Lots of work ahead. I wanted to thank everyone so far for what you've shared. We're looking forward. Karen is up next. I want to do a quick shout out to Senator June Robinson, who has also joined the coffee chat. Thank you for attending and thank you for the support. All right, Karen, please take it away. Let us know, please share our ARPA funded projects are helping to build our childcare capacity and support workforce development.
Hi, thank you. And I'll try to make it quick because I'm sure there's lots of questions and conversation to be had. So Snohomish County received approximately $80 million in federal ARPA funds, and approximately 14 million of those, or almost 18%, were invested in early learning initiatives. And that's a very big deal. I want to start off, just for those of you who don't know, one, I want to say, kind of at the core of all of this, why does early learning matter? It matters because 90% of your brain develops before the age of 5, and it is the foundation for the rest of your life. So it is important for so many reasons. Excuse me. I'm going to quickly put this up. So several years ago, the state legislature required that licensed childcare providers complete ECE certifications as a way to ensure quality early learning. That date has been pushed down the road a little bit, but the work that we were doing in these initiatives really was around helping those licensed childcare provider staff be able to get those ECE certificates and remain employed in the early learning industry, as well as supporting early learning. Next. So we invested early on stabilizing, and then on the second half of the ARPA funds, we wanted to launch some projects that would give us an opportunity to build capacity in the community and hopefully build a roadmap for future investments in funds. So the goal really was around removing barriers for early learning professionals to complete their community college ECE credentials. Next. We invested at 2 levels. We invested at staff who were employed in licensed childcare. This is both family, home, and center. But then we also invested in high school graduates. Next. We did not have a lot of time. So our goal was to invest in systems that already existed, programs that were already providing the similar service somewhere in the community. So it was with Opportunity Council, who is childcare aware of Northwest Washington, Everett Community College, who has ECE courses as part of their department. And because they have done a lot of work in this community, doing program-based, community-based ECE programs. And then Snow Isle Tech Skills Center, who does an amazing amount of projects with high school related to economic development. Next. So again, our goal was to help these folks get their ECE certificates, to do it in a way that really acknowledged what the barriers were and remove those barriers. So we knew that the cohort model, which has been very successful in this county and other initiatives around credentialing was effective. So we wanted to use a cohort model. We wanted to serve people where they were at and make it easier for them to get the degrees. And then the earn and learn program pathway for high school students. We wanted to stabilize the ECE workforce and grow it. We wanted to professionalize the early learning world and the quality of early learning through supporting the capacity building of staff and increase the workforce stability, which has also been the key driver here, because what we knew and feared is that folks were going to be leaving working in the early learning industry to go on to other places, which was only going to make the childcare desert worse than it already was. Okay, next slide. I can't emphasize enough the cohort learning model and approach. So I think there is this assumption sometimes that it's easy to go back to school and navigate. And I would argue that it is harder sometimes to navigate college systems and tuition and subsidy programs than it is to actually take the courses itself. So the goal was to help them get quickly enrolled, make that easy, and then support them. And for a lot of these folks, school may not have been a positive experience, or it's been a while since they've been in school. So we also wanted to provide that college ready, college success support, because a huge piece of it was building the self-efficacy for these folks, that belief that they really could be college students and really could be successful. And then we also know that most of them are parents themselves. They have children they're taking care of. They do not get paid high wages. They work long hours. Transportation is an issue. And when you've worked all day and then you're trying to do classes at night, it is challenging. So we were trying to resolve all of that as best we could. Next. So Snow Isle Tech, for those of you who don't know about them, you should. They're amazing in terms of the magic they do for high school students who can be going to school and also earning vocational credits and job skills. So the goal was to help them get started. They've been wanting to do this, a program just for ECE certification. So the first year was a pilot. Second year was a full launch. This year, it's really about sustaining. So once they get going, they usually can find the funding through reimbursement. We don't have to understand as complex to be able to sustain that. The goal was to also make sure these folks had their STARS ID numbers, which is a big deal. And for those of you who don't know it, it might be more important than like your birth certificate or your marriage license. And if you get it when you're young, you don't have good systems in place to keep track of it. So it was also helping them make sure they kept it in a good place, gave it to a trusted adult, that they always knew how to use that. And also trying to get them para certification, because that is a really great way to enter the workforce, is to be able to also work as a para within the school district. And then they were placing students within the early learning programs with districts to get the work experience. Next. Outcomes were phenomenal as of right now. 55 enrolled, 50 students got their ECE certificate, 12 of them moving on to continued education or working in the field of ECE. And this year, I think is going to be as stupendous as this. So that's pretty exciting. Even if 25% of those 50 folks stay in ECE, it's going to be a really great outcome. Next. Okay, the next was a collaboration. So what we did was provide funds to Childcare Aware, because they have early learning coaches who are all connected to licensed childcare providers, both family, home, and centers, and really use them as that place of recruiting folks into this program, also being really aware of the supports that they needed, and then pulled them together, helped them with the enrollment. And then Everett Community College jumped in. We did some interesting models about how they provided, but we basically bought courses that were hybrid. So they had some in person, most of it was virtual. And then they did a lot of study group and supports for those folks to be able to be successful in that program. Next. Those were the classes that were offered. Next, sorry, I'm just going through quickly on this. Offered things like meals, childcare assistance, transportation assistance. They bought textbooks for them. They got stipends to be paid for their time doing coursework and also for completion of their certificates. Next. So 108 students were enrolled. 32,000 so far were early on have been paid for stipends to complete courses. 31 have completed their ECE certificate, 13 the short certificate, and we still have 2 more cohorts to go. And I missed it on the other one, but I think the exciting thing about this project was there was a really high percentage of folks that were participating that identified as non-white. And I think that's really critical because we're trying to change who is in our workforce for ECE. So I was excited to see that. Most students, said they never believed they could go back to school and get any kind of ECE credential. And now most of them are saying they plan to go all the way. Including maybe as far as the BA, but at least they're full AA and ECE. So that's huge. And some of them are saying, I think I'd like to own my own childcare center, which is also super exciting. Okay, let's go to the next slide. And while you're looking at that, I just want to share, there's some other initiatives that I didn't highlight in this, but I think really reflect or align well with what the early learning report was. So ARPA funds were also used to invest in a few licensed childcare centers for development or for doing some rehab work on their facilities. There was a large RFP. We learned a lot in that process. And part of what we learned is, as was in the report, most folks just didn't have the information or understand all the pre-development phases they had to go through. So we also did a small contract with enterprise community partners who have done this work for years and have some work with King County. And what they did is do the very thing that Jennifer talked about. They help folks understand, what is a feasibility study? What does it mean, to have to get these permits, and walked them through all that, did training, help them put grant applications. And the goal was to have a lot more folks be competitive for the state facility grants. So we already have folks who have gone through that program, who have gotten grant funding. They are putting a toolkit together that we're hoping to have available and online by late fall or winter, that will be available to provide all of that information. We also did some work with Childcare Aware to do some vouchers for families that were mid-income and not eligible for working connections, but also navigating and then connecting folks with other resources to help them find funds to pay for other things so they could focus their funding on childcare cost. And I think those are the other 3 we did. So you can go to the next one because that's exciting. It talks a little bit about a licensed provider. I feel like these are all really phenomenal, and coming from the nonprofit world, sometimes it feels like, oh my gosh, that was expensive. But then when you go back and look at how much the state is losing every year, this is very, very small investment to stabilize and increase our childcare providers in this community. So we are hopeful to try to find some ways to continue these projects with other funding because I think the results have been amazing. So thank you for letting me take the time to share those.
Thank you. Thank you so much, Karen. We are coming to the end of our coffee chat, and I see there's some great questions and conversations going on in the chat. So thank you to those who have been asking and answering. Representative Eslick, I wanted to get one more question to you and then maybe one for the group, and this is going to be rapid fire, so get your engine started here. Representative Eslick, you've been a strong advocate for reducing regulatory burdens and empowering providers. How can the state better support new and existing childcare providers when it comes to licensing, facilities, and workforce development?
Well, I think Jennifer said it well. A peer support system in place would be the coup de grace, I think. We are recognizing peers as valuable and necessary in our world, of every part of our world. So I love that idea, and I think maybe we can work on that plan.
Wonderful. And I have one more shout out for Debbie and Jennifer because there was a stat that I noticed in the survey. So again, rapid fire, but the data showed a mismatch between the supply and demand. 44% of families face long wait lists, yet 35% of providers may have vacancies. So real quickly, how could a family and trusted messenger program help close that gap?
I'll, I can, Jennifer kind of already talked about it, is that we identified that there are families that are harder to reach, which is one of the reasons why we talked about a trusted messenger system, because those are leaders that are already within those communities and have easier access already, rather than hiring a staff person to make those connections. They already have those connections, and they can go deeper in communities and faster into those communities, sharing if they have the knowledge, if they have the connections with providers that do have those empty slots. That's a perfect way to make those connections with those families and those providers.
Love it.
Like
Yep.
Jennifer said, the system needs to be, built out, but yeah, that was kind of the strategy behind it.
Relying on a lot of connections and well, trusted connections in particular. Thank you so much. We have many more questions to get to, and I see some great things in chat. This just means yet again, I see another coffee chat on early learning and childcare in our future. I want to thank Representative Eslick, Debbie, Jennifer, and Karen for sharing all of your amazing insights today. And to all those who joined us for this conversation. It's clear that solving the childcare crisis requires a coordinated action across various sectors. Families, providers, businesses, and government all play a role. What we heard today is that there's already promising efforts underway, from employer surveys to the ARPA-funded capacity building. But we have more work ahead of us to ensure every family can access affordable, high-quality care. By aligning policy, funding, and community partnerships, we can build an early learning system that supports families, strengthens our workforce, and grows our local economy. For those who RSVP today, please check your inbox this afternoon for an email of resources from the discussion. And before we wrap up, I want to invite you all to stay connected with us and continue this important conversation beyond today. Looks like on the slide here on the screen, we have our next coffee chat taking place September 16th, where we'll dive into the topic of workforce housing, another critical issue directly tied to economic growth and quality of life here in Snohomish County. And looking further ahead, next slide, mark your calendars for December 10th. We will gather at Imagine Children's Museum, one of our valued early learning partners, for our annual legislative kickoff. State legislators will join us to discuss key priorities for the upcoming session, including childcare access, workforce development, housing, and many other policies shaping our region's futures. You can find more details and register for both events at economicalliancesc.org/events, or simply scan the QR code on your screen. Thank you again to all of our panelists and everyone who joined us this morning. Oh, there's everyone's faces. Switching to gallery view here, raising our coffee mugs if you got them. I've got iced coffee today. To building to a stronger early learning system and a more resilient workforce here in Snohomish County. Thank you so much. Take care, and we'll see you at the next coffee chat.